Hello, I am State Representative Pam Ferris, and I represent the 48th District in Genesee County, and we are here today to talk about Michigan's drug immunity laws. And I want to introduce Robin to you. Robin has a story to tell that I think we all need to hear, and I want to thank you for joining us today to talk about your story, Robin.
Thank you for having me. I really appreciate it.
Can you tell us about your family story?
Yes, my mother was diagnosed with cancer in about the mid to late 90s, and during the course of her radiation she was given the drug Fosamax to counteract osteoporosis in the affected area. And some years after her treatment was over, she was cancer free. It was very painful, and she endured a lot of suffering with that. The doctors could not figure out what was causing this. Basically what it is osteonecrosis of the jaw, bone death, and that's what was happening.
Bone death?
Bone death, that's what was happening to my mom. They put a metal bar on the outside of her face to keep her jaw in place while she was sleeping so that she wouldn't suffocate. She had a lot of surgeries, and eventually she just essentially gave up. The most infuriating part of it, the story, is that the makers of Fosamax knew about these side effects and hid them from the FDA, hid them from the public, and hid them from the medical community, which is why my mother's doctors could not figure out what was going on.
Right.
And much to my surprise, in Michigan, you are not allowed to sue the makers of drugs that do harm or kill your family members.
We are the only state in the nation that does not allow that.
We are the only state in the nation that does not allow that. We had no recourse. It's like they killed my mother, and there's no way for me to hold them accountable for it.
And that's part of why we have introduced a package of bills that would eliminate Michigan's drug immunity. We've allowed companies to go forward even though they know there are bad drugs, and we have protected them in Michigan. And there are a number of us that want to eliminate that. And your story helps us tell everyone why that should be eliminated.
I would love that, because while I realize it's probably too late for me and my family to get any recourse or to have any recourse in this situation, I do not want this to happen to anybody else.
None of us want this to happen to anybody else.
Because it was pure hell.
When a drug company knows that they are doing wrong by the patients they're serving, there should be recourse for the patient and for the family and for everyone else in the state. And I am truly sorry for what you've gone through.
I appreciate that. I miss my mom every day.